Growth and development during childhood. Growth and development are two related but distinct concepts in child progress. Growth refers to quantitative physical changes, such as increases in height, weight, and other measurable body parameters. Development, on the other hand, involves qualitative changes in skills and functions, including advancements in language, cognition, and motor abilities. While growth reflects the physical expansion of the body, development highlights the evolving capabilities that enable a child to interact more effectively with their environment and achieve greater independence. Human development progresses through distinct stages, each marked by unique characteristics. The neonatal stage, spanning from birth to 28 days, is defined by reflexes, bonding, and basic sensory responses. Infancy, from 1 to 12 months, is a period of rapid growth, motor milestones, and the emergence of first words. Toddlerhood, covering ages 1 to 3 years, brings walking, toilet training, and vocabulary expansion. Preschool years, from 3 to 5, are characterized by imagination, basic self-care skills, and social play. The school-age stage, between 6 and 12 years, involves logical thinking, peer relationships, and steady physical growth. Finally, adolescence, from 13 to 18 years, is marked by puberty, identity formation, and the development of abstract reasoning. Physical development refers to the changes in body size, muscle strength, and coordination that occur throughout growth. It is marked by significant growth spurts during infancy and adolescence, when the body undergoes rapid increases in height and weight. Puberty, in particular, represents a critical phase of physical development, characterized by swift physical and hormonal changes that transform the body and prepare it for adulthood. Cognitive development, as explained by Piaget's stages, unfolds through distinct phases that shape how children think and understand the world. The sensorimotor stage, from birth to about 2 years, is marked by the development of object permanence, where infants realize that objects continue to exist even when out of sight. Between ages 2 and 7, children enter the pre-operational stage, characterized by symbolic thinking and the ability to use words and images to represent objects and experiences. From 7 to 11 years, the concrete operational stage emerges, enabling logical thought and problem-solving about tangible concepts. Finally, beginning around age 12, the formal operational stage allows for abstract reasoning, hypothetical thinking, and the ability to consider complex ideas beyond immediate, concrete experiences. Language development unfolds in a gradual sequence, beginning with crying and babbling as the earliest forms of communication. These vocalizations eventually progress into recognizable words, which then expand into full sentences as children grow. This developmental process is strongly influenced by social interaction, the surrounding environment, and the child's hearing ability, all of which play crucial roles in shaping how effectively language skills are acquired and refined. Emotional and social development unfolds across different stages of childhood and adolescence, each marked by distinct milestones. In infancy, the foundation is built through attachment and trust, as babies form secure bonds with caregivers. During toddlerhood, children begin to assert autonomy, developing independence in simple tasks and decision-making. As they reach school age, peer interaction and teamwork become central, with friendships and cooperative activities shaping their social skills. Finally, adolescence is characterized by identity formation and the pursuit of independence, as young people explore who they are and establish a sense of self while navigating more complex social relationships. Child growth and development are shaped by several influencing factors that work together to determine overall progress. Genetics play a foundational role, as inherited traits from parents influence physical and cognitive potential. Nutrition is equally crucial, providing the essential building blocks for brain function and body development, with deficiencies often leading to delays. The environment also has a significant impact, as safe and stimulating surroundings encourage healthy growth and learning. Health status is another key factor, since chronic illnesses or frequent infections can hinder developmental milestones. Finally, socioeconomic status affects access to education, healthcare, and proper nutrition, thereby influencing opportunities for optimal growth and development. Monitoring growth and development in children involves systematic observation and assessment to ensure they are progressing appropriately. Growth charts are commonly used to track physical parameters such as height, weight, and head circumference, providing a visual representation of a child's growth over time. Pediatricians also rely on developmental milestones, which serve as benchmarks to evaluate a child's progress in areas like motor skills, language, and social interaction. In addition, standardized screening tools such as the Denver-2 and the Ages and Stages questionnaires, ASQ, are employed to identify potential delays or concerns early, allowing for timely intervention and support. Red flags in child development are important indicators that may suggest delays or underlying concerns requiring further evaluation. For example, the absence of social smiling by 3 months can signal difficulties in early emotional engagement. Similarly, if a child has not begun to use words by 18 months, this may point to a delay in language development. Another critical warning sign is the loss of previously acquired skills, which can indicate regression and potential neurological or developmental issues. Persistent clumsiness or significantly delayed motor skills also raise concern, as they may reflect challenges in coordination or muscle development. Identifying these red flags early allows for timely intervention and support to promote healthy growth and development. This presentation highlights the key aspects of child growth and development across different stages. It begins with definitions, distinguishing growth as quantitative physical changes and development as qualitative improvements in skills and functions. The stages of development are outlined from neonatal through adolescence, emphasizing physical, cognitive, language, emotional, and social progress. Influencing factors such as genetics, nutrition, environment, health status, and socioeconomic conditions are discussed as critical determinants of outcomes. Monitoring tools, including growth charts, developmental milestones, and screening instruments like Denver-2 and ASQ, are presented as essential for tracking progress. The presentation also identifies red flags, such as absence of smiling by 3 months, no words by 18 months, regression of skills, or persistent motor delays, that signal potential concerns. Overall, it provides a comprehensive overview of how children grow, develop, and are assessed, while underscoring the importance of early detection and supportive environments for healthy development.